We will see in this video about the femoral artery in detail and the anastomosis it participates with its neighboring arteries. Now, how is this femoral vein that is related to the femoral artery? So, the femoral vein, it continues from the inguinal ligament as external iliac vein, right? So this femoral vein is just medial to the femoral artery beyond the inguinal ligament. The femoral vein, it crosses to the lateral side being posterior to the artery, and at the apex of the femoral triangle, the femoral vein is directly behind the femoral artery, and this is the apex. Later on, this is the adductor canal. So in the adductor canal, the femoral vein is lateral to the femoral artery. Is that clear? So here in the femoral triangle, the femoral vein is medial to the femoral artery, and in the adductor canal, the femoral vein is lateral to the femoral artery. And at the apex of the femoral triangle, the femoral vein is directly behind the femoral artery. Is that clear? So this is the femoral artery, and medial to that is the femoral vein, and this is what is the femoral nerve. So we are not concerned with the nerve as such now. We are just talking about the relation of femoral artery to the femoral vein. We have said that femoral vein is medial in the femoral triangle and lateral in the adductor canal. So let us put it this way about talking about the femoral artery, because we are talking about the femoral artery. So the femoral artery in the femoral triangle is lateral to the femoral vein, and in the adductor canal, this is what is the adductor canal. Once the sartorius is removed, beneath the sartorius is the adductor canal. So in the adductor canal, the femoral artery is medial to the femoral vein, and at the apex of the adductor canal here, the femoral vein is directly behind the femoral artery. So you can put it in either way. You can write in relation to the vein, or talking that artery is medial to this and medial to the vein, or lateral to the vein. So now let us see the relations of the femoral artery to the femoral nerve. So this is the femoral nerve, which is lateral to the femoral artery within the femoral triangle. Okay, and these are its branches. So the femoral nerve, it is divided into anterior and posterior divisions, where the lateral circumflex femoral artery comes between the anterior and posterior divisions of the femoral nerve. So in this diagrammatic representation, this is the trunk of the femoral nerve, the anterior division and the posterior division. So the anterior division has two cutaneous nerves and one muscular nerve, which is the nerve to sartorius. The two cutaneous nerves are the medial femoral cutaneous nerve and the intermediate femoral cutaneous nerve. And the posterior division has 5 branches, of which one is the cutaneous nerve, that is the saphenous nerve, and other 4 are the muscular branches to the quadriceps femoris muscles. The quadriceps muscles being the rectus femoris and 3 vasti, which are the vastus lateralis, vastus medialis. The one behind this rectus femoris is the vastus intermedius muscles. So those are the divisions, the branches from the posterior division. And from the trunk there are two, that is nerve to iliacus, and this one is nerve to pectineus. So now let us see how these femoral nerve and its branches are related to the femoral artery in the femoral triangle as well as in the adductor canal. Right. Now in the femoral triangle, the trunk of the femoral nerve is related to the femoral artery laterally, and this femoral nerve is not included in the femoral sheath. As the nerve enters into the femoral triangle, it divides into two divisions, the anterior and the posterior divisions. Before that, from the trunk, it gives a branch which is nerve to pectineus, which is posterior to the femoral artery. Right? From the divisions, the anterior division, this one, there is this nerve which is called as medial femoral cutaneous nerve. So this medial femoral cutaneous nerve, it is initially lateral to the femoral artery. Then at the apex of the femoral triangle, this medial femoral cutaneous nerve, it crosses the femoral artery from lateral to the medial side. And then the saphenous nerve. The saphenous means superficial. So the saphenous nerve, which crosses the femoral artery from lateral to medial in the adductor canal. So even this saphenous nerve initially is lateral to the femoral artery. Here you can see. And in the adductor canal, it crosses the femoral artery from lateral to the medial side. And this long nerve, which is called as nerve to vastus medialis. This is the vastus medialis. So this nerve to vastus medialis is lateral to the femoral artery also, in the femoral triangle as well as in the adductor canal. Is that clear? So there are 4 nerves that are related to the femoral artery here in the front of the thigh, that is in the femoral triangle and in the adductor canal. From above downwards, let us see what are these nerves that are related. So in the femoral triangle, it is the nerve to pectineus, which is behind the femoral artery, and then at the apex of the femoral triangle, it is the medial femoral cutaneous nerve that is crossing the femoral artery from lateral to medial. Initially, the medial femoral cutaneous nerve is related lateral to the femoral artery in the triangle, and at the apex of the femoral triangle, it crosses from lateral to the medial side. Number 3, the third nerve is the saphenous nerve. In the femoral triangle, it is lateral, and in the adductor canal here, it crosses the femoral artery from lateral to medial side. Number 4 nerve is the nerve to vastus medialis. This is the vastus medialis muscle. Okay. So the nerve to vastus medialis is lateral to the femoral artery in the femoral triangle as well as in the adductor canal. So the other nerve is the genitofemoral nerve. To be more precise, I said it is the femoral branch of the genitofemoral nerve, which is also within the femoral sheath because it descends along with the femoral artery. So initially it is along with the femoral artery placed laterally, and as it enters into the femoral triangle, it appears anterior to the femoral artery, pierces the anterior wall of the femoral sheath, supplying the area over the femoral triangle. Now coming to the profunda femoris artery, which is one of the largest branches of the femoral artery, and it is between the femoral artery and the pectineus and is posterior to the femoral artery. And lower down, as you come down to towards the apex of the femoral triangle, the profunda femoris artery is separated from the femoral artery and the adductor longus. So in the upper part, the profunda femoris artery separates the femoral artery and the pectineus. That is, it is in between the pectineus posteriorly and the femoral artery anteriorly. And as it comes down in the lower part of the femoral triangle, it is between the adductor longus posteriorly and the femoral artery anteriorly. So this is what is the profunda femoris artery, the largest branch of the femoral artery. So clinically, the surgeons, they name the profunda femoris artery as deep femoral artery and the femoral artery as the superficial femoral artery, and before, proximal to the profunda femoris artery, the proximal part of the femoral artery is called as common femoral artery. That is a clinical surgical nomenclature of this artery, just a thing to be known for you. Otherwise, we will just restrict to the anatomical terms, that is the femoral artery. It gives a branch, the largest branch, which is called as profunda femoris artery. Profunda means deep. So, an overview of the relations of the femoral artery. Anteriorly, it is the skin and the superficial fascia, and it is the sartorius also, which passes anteriorly, because just behind the sartorius only, or beneath the sartorius, is the adductor canal, within which the femoral artery is related to all these nerves, the saphenous nerve we said, and the just above the adductor canal at the apex of the femoral triangle, it is related to the medial femoral cutaneous nerve, and still more onto the base of the femoral triangle, nearer to the base of the femoral triangle, it is the femoral branch of the genitofemoral nerve, also is related anteriorly. And then posteriorly, it is resting on psoas major, then pectineus, then it is the adductor longus, and posteriorly there is nerve to pectineus, and there is profunda femoris artery as well. Medially, it is the femoral vein that is present along with its larger tributary, the great saphenous vein. And laterally, it is the femoral nerve with its branches, and all through its course, it is the nerve to vastus medialis, which is lateral to the femoral artery. And the artery, how does it terminate? It terminates passing through the adductor canal, and via the adductor hiatus, it exits the canal and enters into the popliteal fossa as popliteal artery. So the femoral artery, it continues as popliteal artery. So from above, when we take this continuation into consideration, it is the external iliac artery, which continues as femoral artery admitting inguinal point behind the inguinal canal, and this femoral artery continues as popliteal artery in the popliteal fossa. Now coming to the branches of the femoral artery. So the femoral artery, branches, we can divide it into the branches in the femoral triangle and branches in the adductor canal. To be more gross, before dividing the branches, when we just see the branches of the femoral artery, there are 3 superficial branches and 3 deep branches. And the superficial branches are superficial epigastric artery, superficial external pudendal artery, superficial circumflex iliac artery. The deep branches are the profunda femoris artery, the deep external pudendal artery, the descending genicular artery, and the muscular branches. So there are 3 superficial branches and 4 deep branches of the femoral artery. I repeat again, the branches of femoral artery are 3 superficial and 4 deep. The superficial are superficial circumflex iliac artery, superficial epigastric artery, and superficial external pudendal artery. The deep branches are the deep external pudendal artery, the profunda femoris artery, the descending genicular artery, and the muscular branches. So now let us see each of these branch a bit in detail. So the superficial epigastric artery. So this superficial epigastric artery, it crosses the inguinal ligament, enters into the lower part of the abdomen below umbilicus, and it anastomoses with inferior epigastric artery branches. Okay, and then superficial external pudendal, it crosses the femoral vein and spermatic cord. It goes onto the medial aspect to supply the genital areas. And superficial circumflex iliac, it courses laterally along the inguinal ligament and joins with other branches to form spinous anastomosis. And coming to the deep branches, the deep external pudendal, it goes behind the spermatic cord. Superficial external pudendal is anterior to the spermatic cord, deep external pudendal is posterior to the spermatic cord. We'll see all these in detail, little bit in detail in a little while. And this is the profunda femoris artery, the largest branch, which gives the lateral circumflex, medial circumflex, and the perforating arteries, which all participate in various anastomoses, which are very, very important. Blood supply to the muscles of the thigh as well as the head and neck of the humerus as well. And then coming to the descending genicular artery, which gives a branch that participates in genicular anastomosis, that is the anastomosis around the knee joint. And most of these muscular branches, they supply the muscles in the thigh region. Yes, coming to the superficial epigastric artery. This is the superficial epigastric artery, this one. Okay, so now this arises just about 1 centimeter below the inguinal ligament from the femoral artery, and it passes through the femoral sheath. It pierces the femoral sheath and fascia cribrosa of the anterior abdominal wall and turns upwards in front of the inguinal ligament and goes medially till the umbilicus to supply the abdominal wall as far as the near the umbilicus, being between the 2 layers of superficial fascia of the anterior abdominal wall, and it supplies the superficial inguinal group of lymph nodes, the superficial fascia, and the skin. and this anastomosis with the inferior epigastric artery branches and anastomosis with the superficial epigastric artery of the opposite side. Coming to the superficial circumflex iliac artery. This is the superficial circumflex iliac artery. So this is the smallest branch of the femoral artery, the superficial branches of the femoral artery, and it arises along very close to the superficial epigastric artery, and then it pierces the fascia lata and runs laterally parallel to the inguinal ligament till the anterior superior iliac spine. This is the anterior superior iliac spine from where the inguinal ligament is attached to the pubic tubercle. So this courses along the inguinal ligament till the anterior superior iliac spine. Here it divides into branches to supply the integument of the groin region. This is the groin region, the fold between the trunk and the thigh is the groin. So it supplies the skin over the groin. It supplies the superficial fascia and also the superficial inguinal group of lymph nodes because they are here. And this superficial circumflex iliac artery, here in the diagram you can see, it is anastomosing. This is the superficial circumflex iliac artery. It anastomoses with the deep circumflex iliac artery, a branch from the superior gluteal artery, a branch from the lateral circumflex femoral artery, forming an anastomosis near the anterior superior iliac spine, which is called as spinous anastomosis. The spinous anastomosis can be your very short question. So the spinous anastomosis is formed at the anterior superior iliac spine, formed by the superficial circumflex iliac artery, which anastomoses with the deep circumflex iliac artery, a branch from the superior gluteal artery, and an ascending branch from the lateral circumflex femoral artery, and a branch from the iliolumbar artery. So these are the branches of internal iliac artery. So there is a communication between the internal iliac artery and the external iliac arteries branches. So that is what is spinous anastomosis. Coming to the superficial external pudendal artery. So this is the superficial external pudendal artery. This is the superficial epigastric artery. This is the superficial circumflex iliac artery. We have done these two. The other superficial branch, the third superficial branch, is the superficial external pudendal artery. So this superficial external pudendal artery is one of the three pudendal arteries, the other two being internal pudendal artery and deep external pudendal artery. So this arises from the femoral artery nearer to the superficial epigastric and superficial circumflex iliac arteries, and this, after piercing the femoral sheath and the fascia lata, it crosses medial side, medialwards, crosses anterior to, this is the spermatic cord, okay, this is the superficial inguinal ring from which the spermatic cord enters into the scrotum, right? So this superficial external pudendal artery, it crosses in front or anterior to the spermatic cord in the males or in the round ligament in the females, and this artery supplies the integument of the lower part of the anterior abdominal wall. It supplies penis and scrotum of the males and labia majus in the females. And this superficial external pudendal artery, it anastomoses with the branches of internal pudendal artery by crossing the inguinal ligament. Okay, so here in this diagram also you can see this one which is going medially is the superficial external pudendal artery which goes in front of the spermatic cord. So to come out it has to pierce the femoral sheath as well as the fascia lata. Right. Here this is the superficial external pudendal. Okay. This is the internal pudendal which gives the branches to the penis as dorsal artery of penis and the posterior scrotal arteries. So this external pudendal, superficial external pudendal, anastomoses with posterior scrotal arteries, which are the branches of internal pudendal, which is the internal branch of the internal iliac. So here the superficial external pudendal is a branch of femoral artery, which is internal branch of the external iliac. So there is communication that is happening between the branches of internal iliac and the external iliac arteries here. Now coming to the profunda femoris artery. This one is the profunda femoris artery, right? So this is the largest branch of the femoral artery. It is a chief artery that is supplying all the three compartments of the thigh. So this arises from the lateral aspect of the femoral artery about 4 centimeters below the inguinal ligament, right? And this profunda femoris artery, it lies on the iliacus muscle and psoas major muscle. That is the reason it is posterior to the femoral artery, separating femoral artery from iliacus and psoas major muscles. Okay, and then it leaves the femoral artery passing deep to the adductor longus, that is at the apex, and it continues downwards. It first passes between the adductor longus and brevis, and then between longus and magnus in this area. I'll show you the diagram also. And then it ends as fifth perforating branch, the fourth perforating branch, which passes through the fourth osteoeponeurotic opening. Okay, so this is how the termination of the profunda femoris is happening. It terminates as fourth perforating artery, which participates, all these perforating arteries are the branches which participate in longitudinal arterial anastomosis. We will see to it in a little while. Okay, so to remember, it leaves the femoral triangle passing between the adductor longus and brevis, and then it is between adductor longus and adductor magnus, because brevis is still here only. Then it is the whole length is adductor longus. So here it is the brevis. In front of that is adductor longus here. So it is first between longus and brevis. As it comes down, it is between longus and magnus.